Hi everyone, I want to talk about a medication that United States government has approved for the treatment of COVID-19. My last presentation of COVID-19 was COVID-19 fourth edition that was all about preventive measures. In the past, I have published a presentation on hydroxychloroquine, but today I'll be limiting myself to remdesivir. Remdesivir, that is an antiviral agent currently approved by United States government for the treatment of COVID-19 in certain cases of COVID-19 in United States. So with that in mind, let's go. Remdesivir. It is a broad-spectrum antiviral agent. Remdesivir inhibits ribonucleic acid synthesis. It could only be administered via intravenous route only. Uses. United States government has approved remdesivir for the treatment of COVID-19 cases. It is off-label usage anyways. It is available for compassionate use in pregnant women. Still an investigational drug in many parts of the world. In other words, the use of remdesivir for the treatment of COVID-19 is not yet globally accepted, but many countries are still investigating that. Originally developed to treat Ebola virus, Marburg virus, and also useful in treating feline infections, peritonitis. Okay, USA has authorized the use of remdesivir for COVID-19 treatment, particularly in certain situations. Japan is fast-tracking, and Canadian experts were not quite ready for that because they are still demanding more pieces of info before they can start recommending it as a drug of choice for COVID-19. Metabolism. This medication is metabolized by cytochrome P450 found in the liver. So the serum concentration will drop when it is concomitantly administered with hepatic enzyme inducers like rifampicin, carbamazepine, phenobarbital, and so on. So if you administer this medication in, for example, someone with seizure disorder taking carbamazepine and phenobarbital, you might not get any effect because it will be rapidly metabolized. Or someone having tuberculosis taking rifampicin and you administer this medication, you are doing no favor. Note, by March 17, 2020, Czech Republic approved it for COVID-19. This medication is created and developed by Gilead Sciences. On May 1, 2020, United States of America FDA granted the emergency use authorization to treat severe COVID-19 people in adults. In April the same year, Canada allowed its use in volunteers for clinical trials only. It is still an investigational agent in many parts of the world. Not commonly available. It is obtainable through an expanded access program. So we need to contact the Gilead Sciences, the manufacturing company, if you need it, through an expanded access program. So it's not what you can call a pharmacist to supply right away. Not yet. In pediatric age group, as far as COVID-19 and remdesivir will be concerned, it is still currently under investigation. But for children with severe disease for compassionate use, they can have access to it And if that is the case, if the child is less than 40 kilograms, give 5 milligram per kilogram IV start. Then 2.5 milligram per kilogram IV once daily for about 4 to 10 days. But don't use this medication if you have your renal function test and creatinine clearance is less than 30 mL per minute. Don't use in renal impairment. No. In adults, safety and efficacy have not been established. Treatment given is part of the clinical trial. You can give 200 milligram intravenously start on day 1, then 100 milligram intravenously once daily for the next 4 to 10 days. What are the possible adverse reactions? Nausea, vomiting, prolonged prothrombin time is likely going to be mild and very reversible. You can be dealing with raised ALT, and that will also be transient and also reversible. The other side effects could be respiratory failure, hypokalemia. You can check my channel for my publication on potassium, okay? Decreased albumin, decreased red blood cells, decreased platelets. No wonder it's likely that the person might be bleeding. Increased jaundice, increased liver enzyme, decreased blood pressure, swelling and shivering. No wonder the liver is going to be affected. But like I've said, all these side effects are not so scary because once you stop the medication and you assist the patient is likely going to get out of it. So most of them are reversible. One is, be cautious if you are dealing with kidney impairment. Remember, I've earlier stated that when the creatinine clearance is less than 30 beats per minute, you don't administer remdesivir. And why that? The injection contains cyclodextrin, and cyclodextrin can accumulate in the face of renal impairment. And with that, I've come to the end of this presentation. If there's anything confusing, you can pause, rewind, and listen to this presentation all over again. Remember to share and subscribe. I appreciate it. Thank you.